Look at those words, 1 year of COVID. Let's think about that for a second. The now year-long pandemic has taken a major toll on the mental health of the medical workers, too. A new review of 65 studies from around the world finds that 1 in 5 healthcare workers have experienced depression, anxiety, PTSD, or a combination of all of those conditions. The new streaming program, 60 Minutes Plus, shows us one doctor's struggle in Georgia. Wesley Lowery has her story.
Erin Rayburn Rojas, a critical care doctor at Northeast Georgia Medical Center, says her workload is still more than double what it was pre-pandemic, with no relief in sight.
Have there been moments that have felt like you're reaching a breaking point or have been difficult or where you've been overwhelmed?
Every day.
Every day?
Yeah. It's not uncommon for us to take a minute to go cry. I mean, I cry in my office all the time. Everything you do is about getting people better, and a lot of times it just doesn't happen. The lack of being able to help someone in their most vulnerable moments is the injury. The fact that it happens over and over and over again is what I think really causes the damage.
And you've said that you think about walking away from it sometimes.
Yeah.
How seriously do you consider that?
Depends on the day. As I'm preparing for my shift the night before, I start to get a physical reaction to even thinking about going to work. I start to get palpitations. And then I start to think about, why am I doing this? I don't have to do this. There's been days where I've had to take a personal day just because the thought of coming back in and doing the same thing again was just too much. I don't think it substitutes, what will be needed as far as debriefing and therapy after this.
You definitely plan to go to therapy?
Oh, absolutely. Yeah.
Wow, even the helpers need help. 60 Minutes Plus correspondent Wesley Lowery joins us now with more on the story. Wesley, it's good to see you. We just heard that one doctor say, I've often thought about walking away. I know you talked to many healthcare workers. Was that a common thing with them? They just think about leaving?
Of course. I'm actually still down in Northeast Georgia where we've been talking to healthcare workers in rural hospitals, and our team spoke with healthcare workers across the country, and we heard time and time again, we've asked just a monumental task of our medical workers this last year. The amount of death they've seen, the pain they've seen, the surges, and virtually every healthcare worker we talked to said there are times where they have thought about walking away because it's just so difficult.
But they don't, so who is helping them? How are they getting through it?
Well, and that's one of the big questions, and it's one of the big tasks and challenges ahead of us as we emerge from this pandemic, is how do we make sure to take care of these healthcare workers, many of whom are traumatized. Like many professions, medical work does have a stigma around it as it relates to mental health, folks who are scared to come forward and say, I need help. And so there are some organizations, national associations, who are asking for a kind of sweeping attempt to chronicle the mental health of healthcare workers, asking for money to be devoted. There was some money in the COVID relief bill, but asking the Biden administration essentially to create a tracking program like we did for the 9/11 first responders, making sure that everyone who is on the front lines of the pandemic, we know where they are, we know what they're going through, and we can provide help for them.
In our last piece, Wesley, we had a health official say, we don't have a health care system, we have a sick care system. And what you're learning, or what you're hearing, is that now it's actually threatening the stability of what we still call the healthcare system. How so?
Well, we have to remember that even before the pandemic, we were facing a relative crisis in nursing, that we didn't have an overflow of healthcare workers, and now we've asked them to do this Herculean job to respond to a pandemic and a virus that we didn't really know how to deal with initially, and to do so without resources, without time, without PPE. And so we've taken what was already a depleted workforce and then handed them this unthinkable task. And it's going to be unsurprising if in the months to come we see any number of healthcare workers walking away, further depleting the system, making it harder for us to get care.
We got to go, Wesley, but I do want to know what the workers told you about the vaccine.
all the workers we talked to, or most of them, have been vaccinated. They really, really want folks to get vaccinated because what they worry about is as the summer holidays, the spring holidays happen, they're worried that if people aren't vaccinated, they're going to have another surge.
Right. You don't have to tell me twice. Thank you very much, Wesley. Good to see you. If you or someone you know is seeking mental health resources, you can call the National Alliance on Mental Illness, the helpline at 1-800-950-6264. Or in a crisis, you can text NAMI, that's N-A-M-I, to 741-741. And Wesley's full report is on 60 Minutes Plus this Sunday on the new Viacom CBS streaming service Paramount Plus.